Good morning, everyone. This is Ryan Yalung, and I'm reporting with Kat Kinoshita. I'm doing a case study with risk management strategies. Our report is regarding a nurse's failure to report a patient's deteriorating condition to the attending physician and the administration of anti-anxiety medication in the presence of respiratory distress. Her actions caused a settlement of $125,000 and legal expenses of roughly $3,000. So in essence, we have a 28-year-old female who presented to labor and delivery, status post a C-section. The C-section was successful, and she was being monitored post-operatively by the L&D nurse. The L&D nurse was given orders by the attending physician to report to him for deteriorating vital signs, especially for any SpO2 levels below 95%. Eventually, the patient experienced heavy bleeding, cramping, symptoms of anxiety, variable vital signs, weakness, pain. So she called the resident physician as opposed to the attending physician 3 times within the first 4 hours. Also, by the 4th hour, the patient's SpO2 level dropped below 95%. She still did not call the attending physician until the 4th hour. By this time, the patient's condition deteriorated and she coded. She was sent to the OR for emergency surgery, then sent to the ICU, where she ultimately died. So the mistakes that this nurse had done was that she failed to follow the orders to notify the attending physician. And she also gave Xanax to calm down the patient despite her respiratory distress. So Kat's going to cover the quality improvement section regarding the risk management strategies for this patient.
Hi, I'll be covering the risk management portion of this case study. There are 10 components. The first component is to identify the potential risk. In this case was the failure to report changes in patient's condition and review the doctor's order and following them and not reporting to the appropriate attending physician. And lastly, administration of the medication without proper nursing assessment. Second component is to review the monitoring system by going over incident reports, audits, complaints, and survey of the hospital. And third, to analyze all of the incidents and to identify the frequency, whether or not it is isolated case or common case in the hospital. The fourth component is to review and appraise the safety and risk by providing EDU classes to the staff. Fifth component is to monitor law and codes such as BRN or OB Association guidelines. The sixth component is to decrease or eliminate the risk of the incidents. The seventh, to review the incident or the similar cases in other facilities. The eighth components to identify the needs of the patient and the family to implement the program to minimize the risk. The ninth component is to evaluate the effectiveness of risk management by the number of incident report, complaints, patient satisfaction, and the survey response. The last one is to provide a periodic report to the administration, medical staff, and the board of directors.
Okay, so for our colleagues, this information was derived from page 77 of our textbook by Eleanor J. Sullivan. For any more information, it's the risk management approach. Again, it's on page 77. Thank you.